Hello, my name is Danyleyko. This presentation will be on improving patients' association with a primary care provider from telemedicine visits. This, of course, comes from our quality improvement project as set out in our course. My role at my current position is that I'm a South County float that works in multiple areas, primarily in COVID testing and telemedicine. I am a physician assistant, and I work for Providence Express Care, California. So as I thought about what I could do within my practice environment, I considered that many patients are not seen by their primary care provider. So I tried to obtain some data that might be able to help me figure this out, and I looked at the National Ambulatory Medical Care Survey from 2016 and was able to look at some data. And according to the data, of the daily visits, 42.3% of them are with their PCP, but 55% of them are not with their PCP. And of that 55%, 18% or so are referrals. So that leaves quite a few patients that are visiting folks that are not with their PCP every day. So a large percentage of folks and a large number of folks that are doing that. And so that brought me to my next thought was, connecting telemedicine patients with their PCP. Is this an opportunity to improve care? So there wasn't a lot of direct data that said, yes, if you are seen by your PCP, you're going to have improved health outcomes. Now, indirectly or through other ways of describing it, it absolutely gave that implication that patients can improve their care or outcomes by having connections with their PCP. Specifically, it was in some areas like mental health and specialty care. So these are two articles that I reviewed talking about continuity of care and then being seen by a primary care, and were generally associated with favorable patient outcomes. So thus I moved forward with that. So I decided that my mission would be that I'm going to connect telemedicine patients with their primary care provider. How are we going to do that? Well, we're going to do that through our clinic. We're going to do that through multiple processes, which I will discuss further. But let's further discuss about the mission. What and where are we going to get these patients, and how are they associated to our group? So patients who come to use telemedicine come from outside the network and do not have an identified PCP, at least on their electronic health record, or come within our network and don't know who their PCP is, or have not been assigned to an active PCP. So this goes to our mission of connecting telemedicine patients with a primary care provider. By placing a consult or notifying the patient of their current PCP, we hope to influence patient health outcomes across all specialties. So what's our goals? We have four main goals here. We want to, in order to achieve our mission, we want to ensure a strong plan is in place to guarantee success. We want to disseminate information clearly to the team to know what the mission and goals are. We want to support the team and perform continuous review to ensure success. And then we want to attain our quarterly goals for assigning telemedicine patients to their PCP. Of course, the final goal is to try and get to 100% after 12 months of actively being in this process. Making it happen. So how do we make this happen? Well, I identified four groups of folks that, commonly in any type of healthcare practice is we have our support team made up of medical assistants and the IT. We've got our leadership team, which are clinical leads and regional managers. We've got administrators that are overseeing us and in charge of multiple areas, and our regional leaders and our vice president of operations. And then, of course, we've got the team that does the patient care. But it all centers around a consult via the electronic health record. So in order for me to make sure I knew how this worked and how difficult this might be, I wanted to review the details of how to place a consult and how much of a burden it would be on our providers or the people taking care of the patients. So it looked like it was easy as 1, 2, 3, 4. Placing the e-consult order in Epic, which is our active health record, electronic health record that we're using across the system, is pretty simple. It's simply an order. You select consult. You select who you want to consult it to. You accept and sign that order, and then the order is sent through to the corresponding folks that make those assignments. Now, this is an example of a specialist, but in our case, it's just going to be to primary care. And even in the primary care, we're able to identify specific people. So if they said they were at one specific region, we would be able to look at the list of folks in that region and select one of the primary care folks there. So we look at the strategies. In order to make this happen, we need to implement strategies. So how are we going to implement these strategies? Well, we need to do those at the leadership level. So what do the leadership level folks have to do? They have to enter into and continue discussion with the local team. They need to add these to their agenda for their quarterly meetings and discussion. They need to enlist support and promotion to local teams, aka the subject matter expert, create a subject matter expert or identify one. And then lastly, we want to promote and ensure active plan with designated operational support. So besides communication, support is probably one of the most important factors in our strategies. At the team level, we're going to have dedicated time for discussion at the morning huddles on a weekly basis. We're going to provide rationale on a document that all members involved can review via an email and through a live document that's available 24 hours. We'll open a forum and discussion, and we'll get our input and feedback every month. And then we'll provide specific training, video, and then a subject matter expert will be identified to support this. So now we're going to have to collect data and start to assess where we're at and how are we going to attain our goal. So what I thought was that we needed to keep it simple. First, we have to set and publish our quarterly goals. We need to know where we are and where we're headed. Telemedicine providers will be asked to create a new consult if the patient does not have a PCP identified. Patients will be notified if and when a consult is placed. Patients will have an information sheet placed in the EHR, their visit summary for guidance. Then, of course, we're going to obtain the data weekly on the number of actual percentage of PCP assignments in the EHR after the telemedicine visit. What are our leverage points? So how do we make this happen? We've got to have buy-in, communication, and specific goals. As far as the buy-in goes, what I found was that we need to have leadership and team buy-in. If you don't have buy-in, it's not going to happen. It's not going to work. Part of the buy-in comes from them understanding why and better identifying the positive outcomes from this. And then, of course, we've got communication. It needs to be consistent and clear and frequent. And then as far as goals go, we just need to support those goals and we need to publish them so people know where we are and where we're headed. So what is the data we're collecting? We're going to get the goal percentage of PCP assignments in EHR after the telemedicine visits. Sorry, we're not going to get those. The goal percentage is what we're headed to. That's where we want to get to. We're going to publish that. We're going to set that. Then we're going to put that next to the actual percentage of PCPs that are assigned in the electronic health record. And that's after each telemedicine visit. So if we have 100 patients that we're seeing and 75% of those patients do not have an assignment to a PCP, what we want to know is what percentage of those 75 were given consults to get a PCP. In the end, keeping it simple, we just want to know how many folks actually have a PCP assigned to them, and then what percent of folks did we assign for those that were identified not to have a PCP. What you'll see is here that we started off around 12% at the end of the first quarter, put this in place, followed the plan. By the second quarter, we had a nice improvement to 36% of the folks that we saw in telemedicine visits that didn't have a PCP assigned. So we were able to get there. And our goal was to at least have half of those folks get a reassignment. Third quarter, we wanted to get to 75% of those visits being assigned a PCP, and we were able to get to 55. And then our fourth quarter goal is going to be 100%. Of course, that's going to take 2 more quarters, but that's where we're headed, and that's what we'd like to do. So just graphically, I was able to show you the first, second, third quarter. Realistically, if you think about the fact that we're trying to get 4 quarters of active data, we would move through the fourth quarter and into the first quarter of the next year to get us 4 quarters of actual data, and maybe we'd be able to get to that 100%. So in summary, I think it's important to recognize that we had some progress and success in a short period of time with room for improvement. Our mission to connect telemedicine patients with a primary care provider, we were doing that. As far as our goals went, all our goals were executed and implemented. Of course, we didn't achieve our goal of 100%, but we still have 2 more quarters to do that. And in our aim, we improved from 12% to 55% of PCP assignment after a telemedicine visit in the second quarter, in 2 quarters. So I felt quite positive with the results, and overall, we are making great progress towards our final goal, and I've learned a lot from this quality improvement process. Of course, it has a heavy time burden on those putting it together, and there is some time burden in those that make it happen. But in the end, it's to get better outcomes for patients and identification of their primary care provider. Thank you again for your attention, and I hope you enjoyed this presentation. Thank you.